It's all about awareness, is what I say when it comes to health. And today, to talk about robotic surgery, especially about knee replacement, I have Dr. Ratnakar Rao with me, a consultant orthopedician, Care Hospitals, High Tech City. Hello, sir. Welcome to the show, sir.
Hi, Manasa. Hi.
How are you doing, sir, today?
All good, Manasa.
And it's a huge challenge, no, sir, introducing technology in healthcare sector.
It's always challenging.
Yeah.
And it's always advantage also.
Yeah.
To how far we are using this technology to
Yeah.
the human welfare.
Right.
That's more important.
So I want to start with this firstly because we are talking about knee replacement surgery and robotic surgery in that. Tell us about it, sir. What is it basically?
So people have a myth in the robotic surgery also. Robo is an arm in orthopedics. It's like an extra hand to the surgeon to help in the surgery.
Right.
So with this technology and human intelligence will help in recovery of the patient much better way. So technology is always good. If you use in technology in a right way, the results are very good to the patient.
Right.
End of the day. So robo is few years in India we are hearing it, but in the West it is long ago it is came, and it is proving to be advantageous, and it is going to stay.
Right.
So technology have an advancements. Previously we talked about conventional replacement and the navigation is there.
Right.
Navigation hasn't stayed for long, but this is the advancement of the navigation where robo can help in the actual surgery itself.
Right.
So it's an extra arm and extra hand to the surgeon,
Right.
and it's like a brain work to the computer.
Right. And so people get scared, I'm speaking out of experience. When you say robotic surgery, people are like, oh my god, no, there is a fear. Why do you think people fear? What can possibly go wrong? Right?
So people will think robotic surgery means robo will do the surgery.
Yeah.
Or Indian robo like Rajnikant will do the surgery or something. It's not like that.
Yeah.
So in onco, robots are not new in the science.
Right.
So the first robotic surgery was done in 1985 in the US for onco. That's a
Right.
pelvic area, and advancement happened.
Right.
In orthopedics, usually quite few years the robots are there.
Right.
So advancement is like in onco surgery, the surgeon will sit in a console
Right.
and he will give the instructions to the arms. But in ortho robo, the surgery, actually the robo arm will be attached to the table or nearer to the table. Surgeon will perform the surgery. People
Right.
have a myth that robo will operate, doctor won't operate.
Right.
That's a common myth people will think. No, here doctor will operate. Entire thing was done by doctor and will take the assistance of extra hand of the robo in
Right.
performing cuts properly to the level of precision.
Ah, that's the major difference between robotic and conventional knee replacement surgery.
Exactly.
Because there is one arm that helps the doctor. Otherwise, in a conventional surgery, it's just the doctors, and that sort of limits them to a certain extent.
Yes. In robotic surgery, we'll feed the information to the computer.
Right.
After that, it will generate some statistics values of the patient perspective.
Right.
So it depends upon, we have different style of patients, like long body architecture is different. Some are heavy, some are light, some are long, some are short patients.
Right.
So Indian knees are very small when compared to the Western style also.
Right.
So when we add technology to this type of knee surgeries, because the shapes are different from each and every patient.
Right.
So to get that precision level in conventional surgery also we'll have some difficulties.
Right.
So with the help of robo, which takes real-time statistics,
Right.
means we'll give the information to the computer, it will generate something on that. It will give precision levels,
Right.
how much to cut
Yeah.
exactly,
Yeah.
not too much or too less. And thing is, it helps in less bleeding also.
Right.
That helps less infection and early recovery to the patient.
Right.
And our patients usually come at a late stage.
Right.
Late stage in the sense because they will, and the crippled stage.
Right.
Lot of people we see, like they can't move at all, and the legs are bowed.
Right.
In order to balance, surgery is entirely of thinking is not only cuts of removing the bone or putting the implants. It's a balancing.
Right.
You need to balance perfectly between all the muscles, front and back and side to side.
Right.
If these balances are rightly given to the patient, the end result is very good in movement wise, climbing up and walking, no pain.
Right.
So these are the advantages to the patient when the technology is added combinedly to the human brain.
Right. So many advantages. But you specifically mentioned recovery. what I have heard or seen is that when you go for a robotic surgery, recovery rate is faster. Is that right, sir?
Obviously, because we'll handle less soft tissue, means the tissues which will damage in the conventional, in robo we won't do it.
Right.
So that's where the advantage will be there for a faster recovery and early rehabilitation of the patient also.
Right. And also less infection.
Less infection.
Fantastic. And also, sir, when people come and say, okay, let's just go for conventional knee replacement surgery, and what is the one thing you tell them to convince them?
No, it is obviously patient choice. Conventional was done from long back, so the results are good.
Right.
But in some cases, in long-term deformities or people who suffer much,
right,
and people, the bones are very small or some are big, deformities are more. For even conventional also, there are some hitches.
Right.
Because the implants, what we choose, we have a limited range. We need to shoot that knee for that implant.
Right.
So we need to shape according to that. But in robo, the advantage is like that. It's like a patient specific.
Right.
According to the patient shape or geometry of the bone, we have multiple options.
Right.
And the robo gives how much tissue need to be removed, how much tissue need to be released, how much bone to cut.
Right.
That accuracy. So always surgeon hands. Whatever the information we are giving to the computer, it will generate the information and gives you a feedback.
Right.
If you are giving a wrong information to the system, obviously you will get a wrong input.
Right.
So entirely it is your brain working. It is not the robo or computer working.
Right.
So entirely the surgeon is the important person.
Yes.
If you are properly trained, you will give the right information, right statistics to the computer. It will generate information and output will be good.
Right.
So it's always important.
Right.
So giving the right. So in real time we are giving the information to the computer of the patient.
Right.
So then it will generate information and the output is also good.
Right. So there is precision, there is recovery, there is also less infection, there's accuracy, there are too many things, too many advantages. But is there anything else you would like to add about robotic surgery in knee replacement,
Because
sir?
commonly people will ask how much my knee will last.
Yeah.
How long?
Yes.
So what is the longevity?
Yeah.
So simple example, if perfectly done,
Yeah.
even if you fix a door in a wrong way,
Right.
for example, even if you fix a gold door in a wrong way, it won't long last.
Right.
So any implant, it's not about the implant, how you done the surgery, how you balance it, that is more important for the longevity of the knee.
That's right.
It is not the implant.
Right.
Your bone should be perfect, your soft tissue release should be perfect. You are giving ultimately a perfect balance to the patient.
Right.
That's what we say alignment.
Right.
Means our leg should become straight
Right.
to the body axis.
Right.
If you are straight, the walking pattern will change.
Right.
If it is not straight or some deviations will be there, the wear and tear on the plastic will be there. That's where the longevity comes from. If the perfectly done, the longevity will be lifetime.
Yes.
If it is not done perfectly, the wear and tear will be there unevenly. That won't give whatever implant you put, imported or Indian or gold implant, whatever.
Yes, sir.
If your alignment goes wrong or unevenly placed, the longevity won't be there.
Right.
So if it is perfectly placed, it will long last.
Right. This is what we are trying to tell you. Make the right choice because it's your health. It is, something that we can't compromise with. Any last message, sir, you want to give out to my listeners?
So people will ask commonly what is the right time for operation.
Right.
And people wants to delay commonly till they cripple.
Yeah.
By taking some painkillers or some injections into the joint like steroid or PRP, they want to delay the surgery.
Right.
End of the day, they won't understand what's happening.
Yeah.
Because people will think it is a knee is not supporting.
Right.
But it is not the knee entirely. If the knee is not
Right.
people are not walking and they will think my knee is not paining.
Right.
So they'll stop walking. By people are not walking means their lungs and heart also doesn't support them for
Right.
long.
Right.
And their capacity will also come down.
Right.
And it's a wrong choice to people wait till last because the recovery won't happen.
Right.
When the people were walking and the lungs and heart are functioning properly, if the knees are giving a trouble, they can't able to do their activities.
Right.
Don't depend too much on the medicines because
Right.
it's the right time to get the surgery.
Right.
If you are delaying it, you are delaying everything.
Right.
Your recovery is delaying, your heart and lungs function are also delaying, when you want the surgery, they won't cooperate.
Right.
You'll have multiple complications also.
Right.
So people have to understand that by delaying, your health is delayed.
Right.
It's not about the knees, it's the general health is going. The circulation will be dampened. If you are diabetic, the sugar levels will increase. So always have a right time, discuss with the surgeon. So what is the best time for the surgery?
Right, right. So please don't delay such decisions and such surgeries, and also robotic surgery. This is what you need to look up if you're going for a knee replacement surgery, is what Dr. Ratnakar Rao, who's a consultant orthopedician at Care Hospitals, High Tech City, is telling you all. But thank you so much, sir. This was absolutely helpful information.
Thank you, Manasa.